So the question here, the nurse is caring for a client diagnosed with the HIV, uses which infection prevention and control the measure. Select all. So HIV is, there are three category of the disease we need to precursor, like airborne, droplet, and contact precursor. I'm sure every student are know or sure that the HIV is not a airborne disease. And all of you know HIV is not a droplet even. HIV is a contact precursor. So airborne, like COVID-19, we have to follow some rules and regulation to stop the spread of infection. Like we could wear the N95, particularly the respiratory masks for airborne. Or we need the negative pressure or private room and keep the door closed if your patient have a airborne precursor, like tuberculosis, measles, varicella, or smallpox. If the question about the droplet precursor, we better to use the surgical masks when we give the service to the patient within 3 foot of the patient or 3 feet. They also need the private room, and also patient wear surgical masks during the transport. While transport, like your patient in your unit, but they need to go for radiology department for chest x-ray or blood, give the blood sample for blood test. In that scenario, patient need the transport. So during the transport, patient should wear surgical masks. But here the HIV, the question, I said contact precursor. During that deal with the patient who have HIV, we better to follow the standard precursor or contact precursor. Standard precursor means hand washing, simply hand washing and wear the gloves. But some condition in some contact precursor, we use the gloves and gown, and patient, if possible, they give them private room. Or cohorting, during the cohorting, it is good if you give the same infection in the same room. It is good for the patient and for hospital as well. So, or good case, deal with the good patient, like hypertension with another hypertension, pneumonia with another pneumonia, cohorting. But I said the contact precursor, we remove the gloves and gown before leaving the room, right? The example of contact precursor are like example I said, Clostridium deficit or Klebsiella, MRSA, MRSA, or varicella, VRE, RSV, rotavirus, infected pressure ulcer, or any kind of major skin wound, skin infection, impetigo, scabies, HIV. So out there are 5 answers they choose, like gloves when contact with the body fluid is anticipate. So I said the contact precursor, we have to follow the standard precursor, wear the gloves, wash the hand, wet the ground. So gloves, it is right. Gloves when starting an intravenous line, yeah, definitely because of the fluid come in contact with you. Ground gloves, face shield, and goggles for every client, not never ever, right? For contact precursor, we never ever wear all of the PPE. It is not a airborne. Hand hygiene, washing or hygiene before and after every standard precursor. Everybody know, makes sense. N95 respiratory masks, as I told you, we wear only for airborne precursor, right? So let me read this explanation, or let me read the objectives, education objectives, what we have to know. In central disease control and prevention, the recommended use of standard precursor for the preventing the transmission of HIV. I think this is more than enough for one question. Hand hygiene is performed before and after providing client care, because as I told you, the standard precursor, just we go for hand washing, basic. Yeah. And HIV is a blood-borne virus, and standard precursors are sufficient to protect against viral transmission. If I ask you what are the other disease, we have to follow the standard precursor. Example, herpes simplex virus, or Klebsiella pneumoniae, or MRSA, shortly called MRSA, or VRE, or rotavirus. Rotavirus causes bad diarrhea. Herpes zoster, or it's called Seagulls, or any kind of infected pressure ulcer or skin wound, burn infection, very any kind of skin infection like impetigo, pediculosis scabies. So all we need to follow the standard precursor. So question number 2, they said there are 4 rooms. The charge nurse on the orthopedics unit has 4 rooms are available. Which room should the nurse assign to the client being transferred from a post-anesthetics recovery following the total knee replacement, right? So I said the total knee replacement is a major surgical operation, right? In post-operative patient, infection control is really important, and infection control should be always, it is important when we work in the hospital. Infection control should be notified every time a patient with a communicable disease is seen and not admitted. So it is better to inform them. And also, do not cohort post-operative patient with anyone experiencing like some sign symptom like nausea, vomiting, diarrhea, or open wound, or chest drainage, or infection. Because post-operative patient like the total knee replacement, if anybody is nausea, vomiting, diarrhea, maybe you do not know the patient may be because vomiting because of infection, GI infection, or diarrhea because of rotavirus infection, we do not know. So it is good the post-operative patient do not cohorting with any patient who have a chance or experience any sign symptom like nausea, vomiting, diarrhea, or open wound infection or chest drainage, right? Or any infection of chest like pneumonia, we do not cohort in them. They said, which room should the nurse assign the client being transferred from the post-anesthetic recovery unit after following a total knee replacement. So room 1, the client is a skeletal traction following the fracture of the femur. So if anybody, femur is a long bone in the body, any kind of fracture, we use that traction, right? Who has erythema at the pinned site? But we do not know this erythema because of infection or not. But we know we do not give the room who have a chance of infection. Room number 2, the client is a cellulitis. Cellulitis is a skin infection. It's a contact infection. The precursor we have to follow. As I told you, any skin infection like impetigo, pediculosis, scabies, varicella, even cutaneous diphtheria, all are contact precursor or skin infection. Even Ebola, viral conjunctivitis, we do not give the post-operative patient in the same room. Number 3, the client with a compartment syndrome following a injuries. Compartment syndrome following injury, simply, who is one day post fasciectomies. Okay, compartment syndrome following the cross injury. Okay, so number 4 here, they said client with a long leg cast following an open reduction for a fractured tibia. So number 4, a client with a leg cast. Cast already is there, so it is not open, it is closed, right? And out of 4 patient, this room is safer for the patient who came from OT after total knee replacement. Like number 3, compartment syndrome, they said, compartment syndrome basically it does mean increase the pressure in the muscle compartment and causing the muscle and nerve damage along with the pain. So it is also inflammation, right? Number 2, cellulitis, inflammation, and also osteomyelitis. It is an infection of the bones caused by some bacteria or fungi. So number 1, number 2, number 3 all has a chance of infection except number 4. It is that long cast already there. It is not open. There are no chance of infection. It is good to get them in the same room or cohorting in the same room, right? So let me recap one more time what I said. Do not cohort post-operative patient with anyone experiencing the sign and symptom like nausea, vomiting, diarrhea, or open wound. Number 4 is not an open wound, right? Or if a patient have a chest drain or infection like cellulitis, osteomyelitis, we do not give them same room, right? So what is their explanation? A client who in post-operative total knee replacement is at the risk of infection. No post-operative client should be assigned to a room with a client who has an actual infection or potential for infection. This client should be assigned the room number 4 as the client with the cast has the lowest potential risk of infection. Objectives, some objectives. The client who is post-operative total knee replacement is at the increase the risk for infection. This client should not be assigned to a room with a client who has the actual infection or potential infection. Actual means already they have infection like cellulitis, like osteomyelitis. Cellulitis is the infection of the skin. Osteomyelitis, infection of the bones by bacteria or fungi. Potential, maybe chance of the infection, skeletal traction, fasciotomy, other surgery. So question number 3, a client who lives alone had a total laryngectomy for laryngeal cancer. So, my friend, there are keywords. One is the patient is diagnosed by laryngeal cancer 3 months ago and done the laryngectomy operation. First of all, we have to know a little bit. In case of laryngeal cancer, the most common, okay, so in case of laryngeal cancer, we could know the basic symptom of laryngeal cancer are patient develop the hoarseness of voice, patient develop the breathing difficulties, sometimes excessive coughing, sometimes cough come out with blood, neck pain, sore throat, neck swelling, neck lump, and also sudden weight loss. So, my friend, if anybody is diagnosed by the laryngeal cancer, it is most common the person who are chain smoker or who are a singer for a long time, they have a chance. So I said, if anybody have the diagnosed by laryngeal cancer, the saving life is most important. Then we will be talking about the coping mechanism or body image. Saving life is most important, I said, because it is not possible somebody live with hoarseness of voice or breathing difficulties or excessive cough or cough with blood, neck pain, neck sore throat, or I mean pain in the ENT areas, right? So to reduce all of the problem, maybe doctor decided for laryngeal operation, which is called laryngectomy. After this operation, we give a device or procedure is called laryngoesophageal puncture, shortly called TEP. So this laryngoesophageal puncture, sometimes patient has to carry out all lifelong, right? So I said life saving is important to relieve the signs symptoms of the disease is important. Then we'll talk about the coping or body image. The patient is asking something about his issue, then what should be the nursing diagnosis? Why she asking this question, or what her real message about? So she asking, it is a good thing, it is cold outside, so I can keep the hole in my neck covered with a cuff. So to read this question, we get understand the patient already coping, already adapt with the problem, try to recover from it. I do not know what I will do when weather get warmer. So they are thinking about, now it is okay, cold, I can cover it over another by cuff or any cloth, but in warmer, what I will do? So thinking, worried about his fashion, or you can say the outlooks, appearance, right? Outlooks or appearance, I said. So what are the diagnoses, or what are the talking about? What problem? Impaired the verbal communication. No, it is done. Patient continue the talk. Ineffective coping. No, already he copied, already adjusted. Not about this. Ineffective self health maintenance. No, she or he is concerned about her or himself, but thinking about how she looks in where if she does not use the cuff in winter or summer, in summer. So it is talking about the disturbed body image, right? Because I do not know what I will do when, whether get warmer or in summer, what I will do. So thinking about the looks, it is the body image question. So in this picture, we can see the upper respiratory tract, or shortly called ENT, ear, throat, and nose. So this is the sinus here, and you can see trachea, front and back side esophagus is the GI. Gastrointestinal system is behind, and front is trachea, respiratory tract. So here putting the tracheostomy valve, right? So in this operation, we called or we use the tracheoesophageal puncture or device patient have to use. It is important you counseling your patient about the coping. Coping about what? To adjust with the new system, about the body image. So body image is a person attitude about the actual or perceptive structure or function of the body. But if when patient face any kind of health issue, their first physical demand to relieve about the pain or problem. Maslow hierarchy, physical demand is most priorities. After that, we can think about the safety or outlooks or so on, so forth. So the vibration from what that consider normal can result disturbance or dissatisfaction with one's physical self. Disturbed body image is related to the presence of laryngectomy stroma and alter the verbal communication is evidenced by negative feelings about having a key, the hole in the neck. This is the hole. Nobody can feel good. It is good to wear some cuff so other person will not see. But this patient is think about in the summer what I will do, right? So the body image. What are the education objectives here? Let me read it for you, my friend. The client who is undergo a total laryngectomy, the face life altered physical and psychological challenge. It is always, right? When we have some fever, headache, we are think about, oh my God, I'm going to die. But think about the person who is diagnosed by non-curable disease like autoimmune disease, lupus, fibromyalgia, Wagner granulomatosis, how they survive. It is very challenging for the patient, physical challenging and psychological coping mechanism, right? So this includes the inability of breath normally. So it is actually talking about the what are the problem if patient diagnosed with the laryngeal cancer. As I mentioned before, hoarseness of voice is the most priority problem, right? Loss of pitch or hoarseness, inability to taste and smell, breathing difficulties. Sometimes patient complain excessive cough and cough with a blood strain. Presence of permanent tracheal stoma after the tracheostomy operation. But patient also feel with the sore throat, neck pain, ear pain, neck swelling, neck lump. and sudden weight loss. All of this. So disturbed body image, impaired verbal communication, ineffective coping, ineffective self-health maintenance, all is very challenging. So a good counseling is important for your patient. Good counseling about the coping mechanism, adaptation with the new body image, right? So also when patient come to you, it is our responsibilities to diagnose the patient. So appropriate nursing diagnosis for the client with a total laryngectomy we are discussing in this question. So a client called to the nurse to report exacerbation of chronic low back pain. My friend, the chronic disease sometimes causes acute attack, and this is called acute exacerbation of chronic disease. Like I have a bronchial asthma, is a chronic disease from my childhood, but I'm not suffering bronchial asthma every day. But like I went to the flower market and some ray or pollen attacked my respiratory system and I'm get sick. So, and I have to take all antibiotic, bronchodilator or steroid. So it is acute exacerbation of my chronic bronchial asthma, right? So this patient has a low back pain already, and suddenly it is aggravated or exacerbation. And she mentioning all weekend work in the backyard, knowing that the worsened back pain is probably due to the acute inflammation. The nurse recommend which non-pharmacology. This question is really easy, right? Already mentioned non-pharmacological, right? So when patient come to you, always we should try to manage non-pharmacological way first, right? Something is important I want to share with you right away: inflammation. So you see the terminology or keyword here, inflammation. So inflammation in medical field or nursing field again will come, and you have a very transparent and clear ideas about the inflammation. So inflammation, basically a Latin terminology or word, inflammatio, but these are very complex response of the body tissue when body tissue is exposed to any stimuli. What I want to tell you, my friend, when we attack any kind of disease, our body or immune system start to respond, right? And when the response, some change take place, and this response we said inflammation. Inflammation may be from stress, any accident, immune system disturbed, or infection. There are five most common signs of inflammation are pain, redness, swelling, tenderness, increase the temperature. So one is the patient have a low back pain. So pain is one sign of inflammation. So non-pharmacological, definitely you know what are the pharmacological, like you can give some pain medication, non-steroidal anti-inflammatory medication, aspirin, or I mean, I said acetaminophen, right? But non-pharmacological mentioning there. But if we know what are the underlying cause of back pain, and back pain is most common problem, right? Because we do not know how to maintain the body posturing. We do not know what type of activities increase the back pain. So back pain can also be due to sometime I've said back pain can also be due to referred pain sometime from another source. This is important, my friend. As a medic or as a healthcare provider, we could know what are the other different cause of my patient problem. It is good for your patient, and other things that you feel comfortable when give the service to the patient. So I say sometimes back pain also because of due to the related to the pain from another source and is called the referred pain. And referred pain occurred when the pain is felt at a location from different from the source of pain. And also the disease process that can present with back pain including like pancreatitis. Pancreatitis is a disease of the pancreas, but referred pain come to the back. Kidney stone. Sometimes patient has a complaint of back pain. Severe urinary tract infection, sometimes referred to the back pain. Or abdominal aortic aneurysm, sometimes pain is radiated to the back. So when you give the treatment about anything simply like back pain, you have to keep the whole information in the brain. Otherwise, it would be difficult to be a good healthcare provider, right? So I said the here non-pharmacological heating pad is not bad, right? Our grandmother or I mean mother, they know it, but it is not a medical management. And also if your patient has an acute condition, heating increase the inflammatory sign symptom. Heating pad is applied when you are in good condition, not a acute exacerbation, right? Positioning for the comfortness, it is important, but other one like I let me explain first. Exercise increase the problem, so it is not the time advise your patient for the exercise because acute exacerbation stays, right? So it is good for the next, not now. Heating pad is good for the next, not now. Question come 2 and 3. Position is good, but better right away rest from the pain aggravating the activities. So I said, when you take a good history from the patient, you ask them, can you tell me what activities you do, your pain increase? And can you tell me what activities you do, your pain reduce? So aggravating factor and relieving factor. So you tell to stop to the aggravating factor, right? First priorities. So out of this, the best choice is here. Tell your patient not to do the activity, the chance of increase the pain, like walking in the backyard weekend, maybe the bending and weight bearing, it is better to stop non-pharmacological intervention. And let me read it, my friend. Acute aggravation is a chronic back pain usually associated with inflammatory triggered by activities. What activities? Like if patient do not know what exercise they need or repeated the triggering exercise, I mean activities which increase the problem. Intervention should be directed towards reduced inflammation. Non-pharmacological intervention to treat the inflammation include the rest is most priorities, and rest can reduce the sign symptom of inflammation. What are the objectives here? Rest from activities that aggravate the pain and inflammation is a non-pharmacological comfortness. And as a RN or LPN, we can intervene or implement it for my patient to reduce the acute sign symptom like pain. And let me go the next question. Which intervention does the nurse perform to normal rest and sleep pattern for a critically ill patient? Select all. So this question is very, makes sense. We can answer this question from a common sense event. We do not need any, PhD to answer this question. So this question about the critical ill patient or ICU. So in US health system, the critical care medicine basically specialized in caring for most of the serious ill patient. And these patients are best treated basically in ICU. It's called intensive care unit, right? And some hospital maintain some separate unit also, like cardiac, surgical, neurological, so on. So I said, when we're dealing with any patient in critically ill or ICU or even palliative care unit, some palliative care, the patient is really bad and we need to support to the patient with some serious illness, or like hospice care. Hospice care is a subject for palliative care, also aim at the patient in their last month of life. We give them some comfortness, right? And also the, palliative care, hospice care, or intensive care, we provide a variety of services. And what is comfort for my patient? I said. This question comes about the rest and sleep. Like number one, select all, diminish the light at the night. Makes sense, right? Nobody can sleep under the bright light. Increase the level of continuous IV, never. Like I have a night duty in the hospital. Because of my own sleep, I can't increase the sedative. I can't increase the pain medication. And always we give them patient minimum pain medication, right? Because we do not know how patient body responds. Some patient need more pain medication or sedatives. So we do not increase these doses because of our comfortness. Leaving the television on, no, because sound disturbs the patient's sleep. So opening the window, okay, it is good choice, and also shaded for morning for good adjustment. And especially the ill patient always waiting when morning will come. They're waiting for the sunrise. Schedule the intervention and activities. Yes, it is good choice, because if you organize the planning, what is your tomorrow activities, patient will have a mind setup, adaptation, coping, and they always waiting for the next hope. Turning off the equipment, no, it is not good choice because of safety issue. Safety is the most priorities, right? So here they said, and okay, so let me read their explanation for you. It is important to maintain the client normal bodily rhythm with the intensive care unit, or shortly called ICU. intervention that sleep to maintain the normal sleep-wake cycle include diminish the light at the night. It's a normal body mechanism. Provide quiet environment. Don't interrupt the period of sleep, right? And schedule the intervention or planning the activities for the next day is good. Patient will be organized. They prepare themselves. Also, opening the shade in the morning. Excessive stimuli like turn on the TV or bright light impaired the sleep. Also, sleep can predispose the client of delirium. So there are two terminology you could know. One is dementia, other is the delirium. Dementia means forgetfulness, and delirium means when a patient, it is a disorder and characterized by restlessness, some illusion, or incohesiveness of thought and speech. Like I said, illusion. Patient has a false belief or delusion or perception. But basically, the disorder of restlessness or illusion is called delirium. But dementia isn't just forgetfulness. So to prevent the disorientation and delirium in ICU, it is important to develop a plan of care, right? Give them comfort that include maintaining the client normal bodily rhythm.